ट्रेंडी ब्रांड्स को किलो प्राइसेस पे।
So good evening to one and all. फटाफट लाइव रे जॉइन हो जाओ। वर्षा होची बड़ा डिस्टर्ब होची, पावर कट इश्यू होची, बहुत सारा प्रॉब्लम होची। कल राति रे भी 300 क्वेश्चंस हमें कंप्लीट कर पारलेनी, राइट। क्वेश्चन नंबर 284 रे अटकी जाइतिले। सो फटाफट वीडियो को लाइक कर दियो एवं फटाफट जॉइन हो जाओ एवं शेयर मध्य कर दियो निज निज फ्रेंड पाक को, जेमती ए वीडियोटा पहुंची जीवो, राइट। सो साइकोलॉजी रे किछि क्वेश्चंस अछि आ 1516 क्वेश्चन अछि। देन हमें सोशियोलॉजी रे किछि क्वेश्चंस पढिबा, देन हमें मेडिकल सर्जिकल नर्सिंग भी क्वेश्चंस आज देखिबा, राइट। सो ठीक अछि, मोर आवाज आउछि, सुबुची आवाज? सुबुची ना आवाज? एटा कमेंट करो फटाफट, मते सुनी पाउछ ना नहीं, कमेंट करो यस और नो। ठीक, बहुत बढ़िया। सो अगेन गुड इवनिंग टू ऑल। सो आम आज कवर करवा निहाती भाव में 200 रु एबो क्वेश्चंस, राइट। बहुत डिस्टर्ब होची एक्चुअली, बहुत वर्षा होची पटे, राइट ना। फिर भी मु ट्राई करची केमती ज्यादा से ज्यादा क्वेश्चंस आम देखि परिबा, राइट। तो निहाती भाव में आम किंतु 30 डेज रे 10,000 क्वेश्चंस को कवर अप करवा, राइट। एनी हाउ, राइट। 10,000 क्वेश्चंस देखिबा माने देखिबा, ठीक अच्छे। So question number 284 is the scatter singer two factor theory of emotion argues that emotion involves option A thila physiological arousal and cognitive leveling, option B thila only physiological arousal, option C rachi only cognitive leveling, option D rachi only environmental cues. So his option is the correct answer. So काली जो मैंने लाइव रे थिले से मैंने यार आंसर जानि पारिबे निहाती भाव में। तो जो मैंने भी प्रीवियस वीडियो गुड़ा देखी ना से वीडियो सब देखी नहीं तो से वीडियो गुड़ा करे मध्य मोस्ट इंपोर्टेंट एमसीक्यू हम डिस्कशन करछे, मोस्ट इंपोर्टेंट एंड क्रूशियल एमसीक्यू सब डिस्कशन कर सारछे, राइट। है ना। एवं ये जो हमर सेशन चलछे सेटा महा मैराथन क्लासेस चलछे, राइट। सो ऑप्शन ए इज द करेक्ट आंसर, राइट। जो मैंने ये ऑप्शन करछो करेक्ट आंसर। नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 285 रे अछि व्हाट डज द टर्म कोमॉर्बिडिटी, what does the term comorbidity mean in psychology? Option A rachi the presence of two or more disorder in the same individual, option B rachi a rare type of mental illness, option C rachi a successful recovery, option D rachi being afraid of dying. So which option is the correct answer? Which option is the correct answer beta? So correct answer is option A, right. Option A is the correct answer. So comorbidity means it is very common in depression and anxiety disorder, right? Comorbidity is very common. Someone having depression and anxiety disorder, right? So what does the term comorbidity mean in psychology? The presence of two or more disorder, that is anxiety and depression and anxiety disorder, right? Next question beta. Next question hoche procedural memory refers to option A memory of facts, option B memory of how to perform task, for example riding a bike, option C memory of emotional events, option D short term memory. Which one is the correct answer? Which one is the correct answer? So correct answer is option B, right? Option B is the correct answer. Memory of how to perform task, for example riding a bike, right? Now procedural memory refers to how to perform task or riding a bike, right? Next question, question number 287 is the Stanford prison experiment. The Stanford prison experiment conducted by Philip Zimbardo demonstrated the power of option A social rules, option A social rules and institutional factors on behavior, option B personality trait, option C genetics, option D individual free will. So which option is the correct answer? Which option is the correct answer beta? So option A is the correct answer, right? Option A is the correct answer. Social roles and situational factors on behavior, right? The Stanford prison experiment conducted by Philip Zimbardo demonstrated the power of social roles and situational factors on behavior. Next question, question number 288. What is the main goal of humanistic therapy? Option A uncovering unconscious desires, option B self-actualization and personal growth, option C controlling behavior, option D analyzing dreams. Which one is the correct answer beta? So correct answer is option B, self-actualizations and personal growth, right? Correct answer is option B. ठीक है? Next question beta. Question number 289. Which of the following is a symptom of generalized anxiety disorder, GAD? Which of the following is symptoms of GAD, generalized anxiety disorder? Option A excessive persistent worry about everyday things, option B fear of heights, option C feeling happy, option D remembering everything. Which one is the correct answer? Which one is the correct answer beta? So correct answer is option A, right? Option A is the correct answer. Excessive persistent worry about everyday things, right? So GAD the symptoms it pacharchi. So excessive persistent worry about everyday things, that is generalized anxiety disorder symptoms. So next question, question number 290. The recency effect. The recency effect refers to option A better recall for items at the end of a list, option B better recall for items at the beginning, option C remembering old information better, option D forgetting everything. So which option is the correct answer beta? So correct answer is option A, better recall for items at the end of a list, right? Option A is the correct answer. Next question, question number 291. What is social loafing? What is social loafing? Option A being very social in a group, option B putting in less effort when working in a group compared to working alone, right? Option C working harder in a group, option D not wanting to be social. So which option is the correct answer beta? को option हवा correct? सटीक उत्तर यार कौन हवा बेटा? Option B हवा सटीक उत्तर. Putting in less effort when working in a group compared to working alone. That is social loafing, right? Next question, question number 292. Which of the following is considered a standardized test? Option A an an essay exam, option B रचे an IQ test administered the same way to everyone, option C रचे a conversation, and option D रचे an interview. So which option is the correct answer beta? Option B is the correct answer. An IQ test administered the same way to everyone, that is standardized test, right? Next question, question number 293 रचे the mere exposure effect. The mere exposure effect states that option A रचे we tend to dislike things we see often, option B रचे we tend to develop a preference for things merely because we are familiar with them, option C रचे we ignore familiar things, option D रचे we only like new things. So which one is the correct answer beta? Option B is the correct answer. So the mere exposure effect states that we tend to develop a preference for things merely because we are familiar with them, right? Next question, question number 294 रचे divergent thinking. Divergent thinking is a key components of option A रचे intelligence, option B रचे creativity, option C रचे memory, and option D रचे logic. So which one is the correct answer? Correct answer is creativity, right? Divergent thinking is a key component of creativity. ठीक. Next question, question number 295 which is the reticular activating system RAS. The brain is primarily responsible for option A regulating arousal, wakefulness, and attention, option B storing memories, option C controlling speech, option D digestions. So which one is the correct answer beta? So correct answer is option A. The reticular activating system, that is RAS, in the brain is primarily responsible for regulating arousal, wakefulness, and attention, right? So RAS is vital for consciousness and the ability to focus attention, right? Ability to focus attention, that is RAS. And this is vital for consciousness. This is important for consciousness, right? Next question, question number 296. Which psychologist is famous for the Bobo doll experiment? Which psychologist is famous for Bobo doll experiment? Option A Albert Bandura, option B B.F. Skinner, option C Sigmund Freud, option D Jean Piaget. Which option is the correct answer? So correct answer is Albert Bandura. Option A is the correct answer, right? Which psychologist is famous for the Bobo doll experiment? Albert Bandura. And this experiment shows that beta children learn aggression by observing adult behavior, right? Children learn aggression by observing adult behavior. That is social learning theory. देखो कौन कहते social learning theory. Social learning theory. যেতলে children learn করছি by observing adult, right? Children learn aggression by observing adult, right? By observing adult behavior. That is social learning theory, right? So which psychologist famous for the Bobo doll experiment? Albert Bandura. Next question, question number 297. What is cognitive appraisal? What is cognitive appraisal? So option A the process of evaluating an event to determine if it is stressful. Option B a type of test. Option C a learning style. Option B being very critical of oneself, right? So correct option is option A, right? Cognitive appraisal is the process of evaluating an event to determine if it is stressful, right? Option A is the correct answer beta. Next question, question number 298. The temperament in infants is generally considered to be option A innate and biological based, option B entirely learned, option C irrelevant to later personality, option D identical for all babies. So correct answer is option A, right? Innate and biologically based. Temperament in infants is generally considered to be innate and biologically based. Next question, question number 299 achi, the self-fulfilling prophecy occurs when option A achi, our expectation influence our behavior, causing the expectation to come true. Option B achi, we ignore reality. Option C achi, we are always right. Option D achi, we predict the future. So which option is the correct answer, beta? Correct answer is option A, our expectation influence our behavior, causing the expectation to come true, right? So if a teacher believes a student is bright, they may treat them that way, leading the student to perform better, right? जी पढ़ला था. The teacher believes करुछि कि student future bright अछि एवं ठीक ठाक पाठ पढ़ुछि, then that it may treat them to leading student to perform better, right? निहाती भाव student भलो perform करुथुबो, right now. So this is self-fulfilling prophecy occurs when our expectation influence our behavior, causing the expectation to come true. Next question, question number 300. Egocentrism as described by Piaget is the inability to, option A is see things from another person's perspective. Option B is speak clearly. Option C is work. Option D is solve math problems. So which one is the correct answer, beta? So correct answer is option A, right? See things from another person's perspectives, right? So next आज कर डे 2 रो क्वेश्चंस देखिबा, राइट? डे 2 रो क्वेश्चन एठो आरंभ, सोशियोलॉजी क्वेश्चंस, राइट? हमरो डे 1 रो डिस्कशन सरला, एंड डे 2 रो क्वेश्चन आंसर आज एठो आरंभ करबा. ए क्वेश्चन रो आरंभ करबा सोशियोलॉजी questions, right? First question, which considered the father of sociology? Option A is Karl Marx. Option B is August Comte. Option C is Emile Durkheim. Option D is Max Weber. Which option is the correct answer, beta? Which option is the correct answer? फटाफट आंसर करो. So correct answer is, which one is the correct answer, beta? Correct answer is option B, August Comte. Okay. August Comte is the father of sociology, and he coined the term sociology, right? He coined the term sociology, and he is the father of sociology, August Comte, right? Next question, question number 2 rachi, a social group consisting of two parents and their children, right? A social group consisting of two parents and their children is called, option A is extended family, option B is joint family, option C is nuclear family, option D is blended family. So which one is the correct answer, beta? फटाफट आंसर करो ना. So correct answer is nuclear family, right? Option C is the correct answer, beta. Next question, question number 3. Which term describe the process of learning the norms and value of a society? Option A culturation, option B socialization, option C assimilation, option D adoption. Option A acculturation, option B socialization, option C assimilation, option D adaptation. Which term describe the process of learning the norms and value of a society? So correct answer is option B, socializations, right? Socialization have a correct answer. Next question, beta. Question number 4 is the caste system. The caste system is an example of what type of social stratifications? Option A is open system, option B is closed system, option C is meritocratic system, option D is fluid system. Which one is the correct answer? फटाफट आंसर करो बेटा. Sociology रो questions. Social stratification chapter रो questions बेटा. Social stratifications रो. So correct answer is closed system हवा. Option B is the correct answer. Very good. Sangeeta Das. Option B. गायत्री स्वाई बहुत बढ़िया बेटा. लिपिका कुमारी नायक BB. Yes, closed system over, right? Next question, question number 5. Which of the following is considered an achieved status? Option A gender, option B race, option C profession, option D age. Which one is the correct answer? Which of the following is considered an achieved status? So correct answer is professions, right? So achieved status is one that acquired through individual effort, right? Individual effort, individual choice, and individual ability, right? That is achieved status, right? So correct answer is professions. Next question, question number 6. Culture refers to option A the biological traits of a population, option B the complex whole of beliefs, of knowledge, art, and customs shared by a society. Option C the political structure of a nation. Option D the economic growth of a community. But which option is the correct answer? So option B is the correct answer, right? Culture refers to the complex whole of beliefs, knowledge, art, and customs shared by a society. Option B is the correct answer. Next question, question number 7. What is ethnocentrism? What is ethnocentrism? So option A is evaluating other cultures by the standard of one's own culture. Option B is the study of ethnic groups. Option C is promoting cultural diversity. Option D is moving to a new country. So which one is the correct answer, beta? Correct answer is option A, evaluating other cultures by the standard of one's own culture, right? Means ethnocentrism means beta believe that one's own culture is superior to others. Ama cultures mane alga manango to high level, top level. Boli bhai bade that is ethnocentrism, right? So correct answer is option A. Next question, question number 8. Which of the following is a primary agent of socializations? Option A the mass media, option B the family, option C the government, option D the workplace. Which one is the correct answer, beta? Correct answer is the family, right? The family is a primary agent of socialization. The family is a primary agent of socialization. Option B is the correct answer. Next question, question number 9. Social stratifications refers to. Social stratifications refers to. Option A the physical layout of a city. Option B the hierarchical arrangement of individuals into social category. Option C the process of social change. Option D a type of community organizations, right? Social stratifications refers to the physical layout of a city, the hierarchical arrange of individuals into social category. Option C the process of social change. Option D a type of community organizations. Correct answer is, which one is the correct answer, beta? Correct answer is option B, the hierarchical arrangement of individuals into social category, right? Next question, question number 10. An extended family includes option A रचे only parents and children. Option B रचे only siblings. Option C रचे parents, children and other relatives like grandparents, aunts or uncles. Option D रचे neighbors and friends. So which one is the correct answer? Extended family includes parents and children. Option B रचे only siblings. Option C रचे parents, children and other relatives like grandparents, aunts or uncles. And option D रचे neighbors and friends. तो करेक्ट आंसर इज ऑप्शन सी बेटा, ऑप्शन सी। वेरी गुड, बहुत बढ़िया, ऑप्शन सी इज द करेक्ट आंसर बेटा। जो मैंने ऑप्शन सी कर बहुत बढ़िया, वेरी गुड, बहुत बढ़िया। नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 11 है, व्हिच टर्म डिस्क्राइब ए चेंज इन सोशल पोजीशन विद इन द हायरार्की। व्हिच टर्म डिस्क्राइब ए चेंज इन सोशल पोजीशन विद द हायरार्की। ऑप्शन ए रचे सोशलाइजेशन, ऑप्शन बी रचे सोशल मोबिलिटी, ऑप्शन सी रचे सोशल चेंज, ऑप्शन डी रचे सोशल कंट्रोल। व्हिच वन इज द करेक्ट आंसर? सो करेक्ट आंसर इज ऑप्शन बी बेटा, सोशल मोबिलिटी, राइट? सोशल मोबिलिटी, सोशल मोबिलिटी डिस्क्राइब चेंजेस इन सोशल पोजीशन विद द हायरार्की, राइट? नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 12 अच्छी, व्हाट इज नॉर्म्स? What is norms? Option A rules that guide behavior in society. Option B the physical health of a group. Option C the study of population statistics. And option D a type of family structure. So correct answer is option A, right? Rules that guide behavior in society. Rules that guide behavior in society. Next question, question number 13 is Moore's are norms that option A have great moral significance. Option B are just customs, folkways, that is folkways. Option C are only for children. Option D change every day. So which one is the correct answer? So correct answer is option A होगा बेटा, have a great moral significance, right? Have a great moral significance. Next question, question number 14 is the study of human populations, the study of populations, size, distribution and composition each. The study of human population size, distribution and composition each. Important MCQ already exam रे आसे सारी ची बेटा। ऑप्शन ए रची एपिडेमियोलॉजी, ऑप्शन बी रची डेमोग्राफी, ऑप्शन सी रची एंथ्रोपोलॉजी, ऑप्शन डी रची जियोग्राफी। सो व्हिच ऑप्शन इज द करेक्ट आंसर? व्हिच ऑप्शन इज द करेक्ट आंसर बेटा? फटाफट आंसर कर दो बेटा। So correct answer is demography, right? Next question. Question number 15 is which of the following is a global issue affecting health? Option A is urbanization, option B is poverty, option C is aging population, option D is all of the above. Which of the following is a global issue affecting health? So correct answer is all of the above, right? Urbanization, poverty, aging population. So all of the above correct answer. Option D is the correct answer, beta. Next question, question number 16 is what is anomie? What is anomie? Option is a sense of normalness or social instability. Option B is a type of family structure. Option C is a health condition. Option D is a positive social trait. Which option is the correct answer? So Emil Durkheim defined anomie. ये डेफिनेशन देथिले, एनोमी रो डेफिनेशन के देथिले? Emil Durkheim defines anomie, right? A state defined as a state where social norms are weak or absent, leading to instability, right? Social norms are weak or absent, leading to instability. So correct answer कौन हम बेटा option A हवा right. Enemy. So Emil Durkheim define anomie right is a state where social norms right are weak or absent leading to instability. Okay. Option A होगा correct answer. Next question, question number 17, which is an example of informal social control? Option A रहे laws, option B रहे police enforcement, option C रहे gossiping or social approval or disapproval, option D रहे prison sentences. So which option is the correct answer beta? So correct answer is option C. Gossiping or social approval or disapproval is an example of informal social control, right? So option C is the correct answer, right now. Next question, question number 18. A reference group is a group that option A we use a standard for evaluating ourselves, option B we belong to but dislike, option C we have never heard of, option D only consists of family. So which option is the correct answer? Correct answer is option A, right? We use as a standard for evaluating ourselves. Next question, question number 19. Urbanization is the movement of people from option A cities to rural areas, option B rural areas to cities, option C one country to another, option D one house to another. So which option is the correct answer? Which option is the correct answer? Answer करो फटाफट. So correct answer is beta option B, rural area to cities होगा, है ना? Rural area to cities, that is urbanization is the movement of people from rural areas to cities, right? Next question, question number 20. What is cultural lag? What is cultural lag? Option A is culture that is moving slowly, option B is the period of maladjustment when non-material culture struggle to adapt to new material culture, that is technology, option C is type of language, option D is delay in government service. So which option is the correct answer beta? Correct answer is option B, right? A period of maladjustment when non-material culture struggle to adapt to new material culture or technology. Option B is the correct answer, right? And cultural lag, who was coined by cultural lag term? So cultural lag term coined by William Ogburn, right? William Ogburn coined the term cultural lag, right? Next question, question number 21 is which type of society is primarily agricultural? Option A industrial, option B post industrial, option C agrarian, option D hunter gatherer. So which option is the correct answer beta? Correct answer is option C, agrarian societies rely on farming and cultivations, right? Agrarian family or societies, rely on farming and cultivation. And is their primary economic activity. Agrarian societies, this is the primary economic activity of agrarian societies, right? So option C is the correct answer beta. Next question number 22 prejudice is a dash where whereas discrimination is a dash. Option A is action, attitude. Option B is attitude, actions. Option C is behavior, feeling. Option D is fact, opinion. Which option is the correct answer, beta? Which option is the correct answer? So prejudice is a preconceived opinion, right? Preconceived opinion. While discrimination is unfair treatment, right? Unfair. Prejudice is a preconceived opinion. Preconceived opinion. Preconceived opinion. Whereas discrimination is unfair treatment. Discrimination is an unfair treatment. So कौन option है बेटा correct answer? Which option is the correct answer? So prejudice is a preconceived opinion, that is the attitude, right? And discrimination is an unfair treatment, that is our actions, right? It is our work, it is our actions. So option B is the correct answer, beta. Option B is the correct answer. Prejudice is an attitude, whereas discrimination is an actions, right? Option B is the correct answer. Next question, question number 23. What is the role of religion in society according to functionalist? Option A to cause conflict. Option B to provide social cohesion and meaning. Option C to increase economic output. Option D to replace science. So which option is the correct answer? Which option is the correct answer? Option B is the correct answer. To provide social cohesion and meaning. It is the role of religion in society according to functionalist, right? Next question, question number 24. Deviance is defined as option A any behavior that violates social norms. Option B a criminal act. Option C being different. Option D a positive trait. Which one is the correct answer, beta? So correct answer is any behavior that violates social norm, right? That is deviance. ठीक. Next question number 25 the gender role refers to question number 25 option option A the biological sex of an individual. Option B socially constructed expectation of behavior for men and women. Option C the age of a person. Option D a person's salary. So which option is the correct answer? So option B is the correct answer, beta. The gender role refers to socially constructed expectation of behavior for men and women, right? So option B is the correct answer. Next question, question number 26. Sociology questions. Which of the following is considered a primary group? Which of the following is considered a primary group? Option A large corporations. Option B a political party. Option C a family. Option D a trade union. So which one is the correct answer, beta? Correct answer is a family. Family is primary groups. No. Next question, question number 27. The process of moving from a rural lifestyle to an urban lifestyle is associated with. Option A increased traditionalism. Option B greater division of labor and secondary relationships. Option C isolation of the individual. Option D decrease in populations. So which option is the correct answer? Which option is the correct answer? Correct answer is option B, greater division of labor and secondary relationship. Next question, question number 28. What is the looking glass self? What is the looking glass self theory? Option A we form our self image based on how we think others perceive us. We form our self image based on how we think others perceive us. Option B we only look at ourselves in mirrors. Option C we are born with a fixed personality. Option D our self image is determined by genetics. So which option is the correct answer, beta? Correct answer is option A. We form our self-image based on how we think others perceive us. And this theory proposed by Charles Horton Coley. This theory proposed by Charles Horton Coley. Right? This theory was proposed by Charles Horton Coley. Next question, question number 29. Which of the following is a type of social mobility where an individual's status changes within their lifetime? Option A is intergenerational mobility. Option B is intragenerational mobility. Option C is structural mobility. Option D is geographic mobility. So which option is the correct answer, beta? So correct answer is option B, intergenerational mobility. Intergenerational mobility refers to changes in social position during a single person's career, right? Next question number 30. Patriarchy is a social system where option A is women hold primary power. Option B is men hold primary power and predominant in roles of leadership. Option C is power is shared equally. Option D is there is no power structure. So which option is the correct answer? Which option is the correct answer? So correct answer is option B. Men hold primary power and predominant in roles of leadership. Right? So correct answer is option B. Next question, question number 31 is which of the following is an example of a secondary group? Option A is a close knit group of friends. Option B is a labor union. Option C is a parent-child relationship. Option D is siblings. So which option is the correct answer? Which option is correct answer? बेटा को ऑप्शन सठिक हबो सठिक आंसर हबो ऑप्शन बी ठीक ए लेबर यूनियन नेक्स्ट क्वेश्चन क्वेश्चन नंबर 32 रहे ascribed status each option is earned through hard work. Option B is assigned at birth or involuntary later in life. Option C is always temporary. Option D is something we choose. So correct option कौन होगा? Assigned at birth or involuntary later in life, right? Ascribed status example है race, sex and age factors, right? Age factors over which the individuals has no control. ठीक एटा हमरो किसी कंट्रोल नहीं which the individual has no control. Individual has no control. No control. ठीक मैं कंट्रोल कर पारे कि रेस ऊपर सेक्स ऊपर कि एज फैक्टर्स ऊपर नहीं ना. So that is ascribed status assigned at birth or involuntary later in life. Ascribed status. Next question, question number 33. What is the primary function of social control? What is the primary function of social control? Option A to encourage deviance. Option B to maintain social order and conformity. Option C to increase population growth. Option D to promote anarchy. Which option is the correct answer, beta? Which option is the correct answer? So correct answer is option B, to maintain social order and conformity. Next question, question number 34. Subculture refers to option A a culture that is superior to others. Option B a group whose values and norms are distinct from the mainstream culture. Option C is a non-existent culture. Option D is the culture of the ruling class. So which option is the correct answer, beta? Draft chat answer करो. So correct answer is option B. A group whose values and norms are distinct from the mainstream culture. Next question, question number 35, which is the term social effect was introduced by which sociologist? The term social effect was introduced by which sociologist? Option A August Comet, option B Emile Durkheim, option C Karl Marx, option D Max Weber. So correct answer is Emile Durkheim, right? Durkheim used social effects, right, to describe values or cultural norms and structure that transcends the individuals, right? So social effect के introduced करथिले Mild Durkheim. Option B is the correct answer. Next question, question number 36. What is secularization? What is secularization? Option A is the increasing influence of religion in daily life. Option B is the declining influence of religious institution in modern society. Option C is the rise of new religions. And option D is a political movement. Which option is the correct answer, beta? Which option is the correct answer? Correct answer is option B, the declining influence of religious institution in modern society, right? So option B is the correct answer. Next question, question number 37. Which of the following is a formal social control mechanism? Which of the following is a formal social control mechanism? Option A is same, option B is peer pressure, option C is legislation and judicial system, option D is parental disapproval. So which option is the correct answer, beta? Correct answer is option C, legislation and judicial system, right? Legislation and judicial system is a formal social control mechanism, right? Next question, question number 38. Socialization that occurs in adulthood, often for a new role or like a new job, is called option A primary socialization, option B resocialization, option C anticipatory socialization, option D developmental socialization. Which one is the correct answer, beta? Which one is the correct answer? The correct answer is resocialization. Socialization that occurs in adulthood, often for a new role or like a new job, is called resocialization, right? Option B is the correct answer, beta. Next question, question number 39 achi. Next question, question number 39 achi, beta. What is wealth in sociological terms? What is wealth in socialization? Sorry, what is wealth in sociological terms? What is wealth in sociological terms? Option A is just the salary one earns. Option B is the total value of all assets owned by an individual. Option C is being happy. Option D is having many friends. So which option is the correct answer? Correct answer is option B, beta. So wealth in sociological terms, the total value of all assets owned by an individual, right? Hence includes property, savings, right? And another, and also investment, right? Investments and other financial assets. Unlike just income, right? This is the wealth in sociological terms, and that is the total value of all assets owned by an individual, right? So option B is the correct answer, right? Next question, question number 40. Ethnocentrism is often contrasted with option A cultural relativism, option B nationalism, option C xenophobia, option D racism. So correct answer is cultural relativism. So cultural relativism is the practice of judging a culture by its own standard rather than one's own, right? It is the practice of judging a culture by its own standard rather than one's own, right? Next question, question number 41. Which sociologist is famous for the concept of class struggle? Which sociologist is famous for the concept of class struggle? Option A Emile Durkheim, option B Karl Marx, option C August Comte, option D Max Weber. So which option is the correct answer, beta? Class struggle. Famous for the concept of class struggle. And this is So correct answer of option B, Karl Marx. Right? Next question, question number 42 is bureaucracy is characterized by. Bureaucracy is characterized by option A informal rules, option B hierarchy of impersonality and written rules, option C emotional decision making, option D lack of leadership. So correct answer is option B, hierarchy, impersonality and written rules. Right? Next question, question number 43, which of the following impacts the social determinants of health? Option A educational level, option B socio-economic status, and option C is physical environment, option D is all of the above. So beta correct answer of all of the above, right? Which of the following impacts the social determinants of health? Education also, socio-economic status also, and physical environment also. So all of the above have a correct answer. Next question. Question number 44. What is the nuclear family most common in? What is the nuclear family most common in? Option A is agrarian societies, option B is industrial or modern societies, option C is hunter gatherer tribes, option D is ancient civilizations. Correct answer कौन है बेटा? Correct answer is nuclear family most common in option B, industrial and modern societies. Industrial and modern societies. This is mobile family units, right? More mobile family units. Next question, question number 45 is group dynamics is the study of option A individual personality, option B the way people interact and behave in groups, option C population growth, option D history of countries. Which one is the correct answer beta? Group dynamics is the study of, which option is the correct answer? फटाफट आंसर करा बेटा, जल्दी जल्दी सॉरी बा. So correct answer is option B, right? Correct answer is option B, the way people interacted and behave in groups. Next question, question number 46 is which of the following is a negative sanction? Option A is a promotion, option B is a fine or imprisonment, option C is a price, option D is a medal. So correct answer is option B, a fine or imprisonment. Right? Negative sanctions means punishment, right? And discourage. And this is deviant the behaviors, changes the behavior, right? So this is a fine or imprisonment, right? Next question, question number 47. Modernization refers to option A the process of societal shift from traditional to industrial or technological society. Option B is making clothes. Option C is learning a new language. Option D is building new houses. Which one is the correct answer? Correct answer is option A, the process of societal shift from traditional to industrial or technological society. Option E is the correct answer. But next question, question number 48. Values are defined as option A is what we do. Option B is shared idea about what is desirable, good or important. Option C is laws that must be followed. Option D is the physical items we own. So which option is the correct answer beta? Correct answer is option B, share idea about what is desirable, good or important. That is value, right? That is called value. Next question, which of the following is a total institutions? Which of the following is a total institutions? So option A is a public park, option B is a grocery store, option C is a prison or mental health hospital, option D is a school. So correct answer is option C. Next question, question number 50 is what is mass media? What is mass media? Option A is a small group of friends. Option B is a means of communication that reach large audiences. TV, internet, newspaper. Option C is a private letters. Option D is a books only. Which option is the correct answer? बेटा फटाफट आंसर करो, फटाफट आंसर करो. What is mass media? What is mass media? फटाफट आंसर कर दो. गायत्री स्वाई, सस्मिता प्रियदर्शनी, सोनालिका पति. बहुत बढ़िया बेटा. Very good. Option B is the correct answer, right? Means of communication that reach large audiences. That is TV, internet, newspaper. These all are mass media, right? Next question, question number 51. What is conspicuous consumptions? Option A is saving money for the future. Option B is purchasing luxury goods to display social status. Option C is buying only essential items. Option D is sharing resources in the community. So correct answer is option B, purchasing luxury goods to display social status. Next question, question number 52. Which factor is a significant determinant of social class in modern society? Which factor is a significant determinant of social class in modern society? Option A is occupation, option B is education, option C is income, and option D is all of the above. So correct answer is all of the above, beta. Occupation also, education also, and income also, right? These all are the determinant of social class in modern society. Next question, question number 53 is cultural diffusion. Each option A is the spread of cultural beliefs and social activities from one group to another. Option B is the decline of a culture. Option C is the loss of language. Option D is the creation of a new religion. So which option is the correct answer, beta? So correct answer is option A, right? The spread of cultural beliefs and social activities from one group to another. That is cultural diffusion. Cultural diffusion is the spread of cultural beliefs and social activities from one group to another. Next question number 54. What is social cohesion? What is social cohesion? Option A is the force that binds society together. Option B is the conflict between social groups. Option C is the process of urbanization. Option D is the decline of family values. So correct answer is the force that binds society together, right? So option A is the correct answer, beta. Next question, question number 55. In the context of health, illness refers to option A the biological pathology. Option B the patient's subjective experience and social reactions to. In the context of health, illness refers to the patient's subjective experience and social reaction to disease. Right? Next question. Question number 56. What is the sick role? What is the sick role? Option A concept describing the social expectation and obligation of a sick person. Of a sick person. What is the sick role? A concept describing the social expectation and obligation of a sick person. Option B is being physically ill. Option C is a medical condition. Option D is ignoring health problems. Which option is the correct answer? So correct answer is which option? Which option is the correct answer, beta? Correct answer is option A. Right? Correct answer is option A. Next question, beta. Question number 57. Which of the following is a major social institutions? Option A is a family. Option B is a religion. Option C is education. Option D is all of the above. So answer करो फटाफट. आंसर करो फटाफट. which of the following is a major social institution? Major social institution. Option A. Option A हवा बेटा सब option हवा. All are the major social institutions. All of the above haba. Option D is the correct answer beta. All of the above haba. All of the above. Family also a major social institution. Religion also a major social institutions. Education also a major social institutions. Right? All of the above haba. Social institutions means beta established structure that meet the basic needs of society. Right? आमे जो सब needs पाउचे आमे जहाँ दरकार. Right. Next question. Question number 58 is gender identity. Each option is a person's internal sense of their own gender. Option B is the biological sex assigned at birth. Option C is a person's salary. Option D is a person's educational qualifications. Which option is the correct answer? Gender identity. So option A is the correct answer. Beta. Person's internal sense of their own gender. That is gender identity. Next question. Question number 59 is a rural society is typically characterized by option A is a high density of population. Option B is formal social relationships. Option C is close social ties and traditions. Option D is industrializations. So correct answer is, which one is the correct answer beta? Correct answer is option C, close social ties and tradition. Rural society is typically characterized by close social ties and tradition. Option C is the correct answer. Next question. Question number 60 is what is social integration? What is social integration? Option A is the process by which individuals are included into the social system. Then option B is the segregation of groups. Option C is the economic downfall. Option D is the loss of culture. So which one is the correct answer? Which one is the correct answer beta? Which one is the correct answer? Option A is the correct answer, right? Option A is the correct answer. Social integration is the process by which individuals are included into the social system, right? Option A is the correct answer. Next question. Question number 61 is xenophobia is the fear or hatred of. Option A is people from other countries. Option B is spiders. Option C is public speaking. Option D is dark spaces. So correct answer is option A, people from other country. That is xenophobia. So xenophobia is an irrational fear or dislike of stranger or foreigner. It's or foreigners. People from other country. Dislike of stranger or foreigners. Fear or dislike of strangers or foreigners. Right? So option A is the correct answer. Xenophobia. Next question number 62. What does global inequality refers to? Option A is difference in wealth and power between nations. Option B is the size of the earth. Option C is the same standard of living everywhere. Option D is the lack of technology. The lack of technology. So which option is the correct answer beta? So correct answer is option A. Right? Option A, difference in wealth and power between nations, that is global inequality. Next question. Question number 63. Which of the following is a characteristics of democracy? Which of the following is a characteristics of democracy? Option A is a rule by a single person. Option B is a power held by the people. Option C is a military rule. Option D is a totalitarian control. Correct answer is option B, power held by the people. That is democracy. Power held by the people. Next question. Question number 64. What is ageism? Option A is prejudice or discrimination against individuals based on their age. Option B is the study of aging. Option C is celebrating birthday. Option D is working for a long time. So correct answer is option A, prejudice or discrimination against individual based on their age. That is ageism. Right? Next question number 65. Which is social change can be triggered by. Social change can be triggered by option A technological innovations. Option B natural disaster. Option C social movements. Option D all of the above. So correct answer is all of the above. Social change can be triggered by technological innovation, natural disaster, social movement. So all of the above over here. Correct answer. Next question number 66. Which type of society relies on information and service sectors? Option A रचे agrarian, option B रचे industrial, option C रचे post industrial, option C रचे feudal. So correct answer is post industrial, right? Post industrial society relies on information and service, right? Next question number 67 which is social class is usually determined by. Social class is usually determined by. Social class is usually determined by. Option wealth, option A is wealth, power and prestige. Option B is hair color. Option C is height. Option D is number of sibling. Social class is usually determined by wealth, power and prestige, hair color. Option C is height. Option D is number of sibling. So correct answer is option A, wealth, power and prestige. This is determined class. Class is determined by wealth, power and prestige. Next question number 68. What is meritocracy? What is meritocracy? Option A is a system where advancement is based on individual ability. Option B is a system based on inherited wealth. Option C is a dictatorship, a system where everyone is paid the same. So which option is the correct answer, beta? So correct answer option A, system where advancement is based on individual ability, right? So you can emphasize that hard work and talent are the primary drive of success. Primary drive of success, right? Meritocracy that hard work and talent are the primary drive of success, right? Next question number 69. Relative poverty each option is having enough to survive but less than other in the same society. Option B is being able to afford basic needs. Option C is not having enough for food and shelter. Option D is being rich. Being rich. So option is the correct answer. Relative theory. So correct answer is option A. Enough to survive but less than others in the same society. Next question number 70. Which social institution is primarily responsible for the transmission of knowledge? Which social institution is primarily responsible for the transmission of knowledge? Option A is education. Option C is politics. So correct answer is education. Education system, right? Education system. Education system. Right now. Education system which is social institution is primarily responsible for transmission of knowledge. Option B is the correct answer. Next question number 71. Conformity is often motivated by. Conformity is often motivated by. Option A is the desire to be liked or to be correct. Option B is desire to be arrested. Option C is purely random choice. Option D is independence. So which option is the correct answer? Correct option is option A, the desire to be liked or to be correct. That is conformity, right? Conformity is often motivated by the desire to be linked or to be correct. Next question number 72. Social disruption occurs when society functions normally. Established social patterns are challenged or broken. Option C is population is stable. Option D is everyone follows the rules. Which one is the correct answer? So correct option is option B, beta. Established social patterns are challenged or broken, right? Option B is the correct answer. That is social disruption occurs when established social patterns are challenged or broken, right? Next question number 3. Lack of basic necessities like food, water and shelter. Lack of basic necessities like food, water and shelter. Option B is having less than the average person. Option C is unable to afford acre. Option D is having only one home. So the answer is option A, a lack of basic necessities like food, water and shelter is called as self-poverty. Next question number 4 is stereotype. Option is a reliable fact. Option B is a generalized or simplified about a group. Option C is a professional. Option D is a type of law. So which one is the correct answer, beta? Option B is the correct answer, right? Stereotype which is generalized or simplified belief about a group. Next question 75. Which sociologist is associated with the study of bureaucracy? Option A is Max Weber. Option is Karl Marx. Option C is Emil Durkheim. Option D is Herbert Spencer. So that is Max Weber, right? Max Weber. So bureaucracy, Max Weber viewed that bureaucracy is the defining structure of modern rationalization society, right? Next question, social Darwinism. What is social Darwinism? So option A is the belief that social progress is driven by the survival of the fittest. Option B is study of animal behavior. Option C is a theory of population growth. Option D is the study of ancient civilizations. So correct answer is option A, the belief that social progress is driven by the survival of the fittest. Right? Next question, question 77. What is the alienation? What is alienation according to Karl Marx? Which is the sense of powerlessness and separation experienced by worker in a capitalist system. Option B is being moved to a new country. Option C is psychological disorder. Option D, the loss of memory. So correct answer is option A, the sense of powerlessness and separation experienced by workers in a capitalist system. Right? So option A is the correct answer. Beta. Question number 78. Which of the following is a latent functions of education? Which of the following is a latent functions of education? Option A is teaching, reading, acting, providing childcare and social opportunities. Option C is preparing students for careers. Option D is promoting nationalism. Right? So which option is the correct answer? Which of the following is a latent function of education? So correct option is option B, providing childcare and social opportunities. Next question, question number 79. Socialization ends when? Option A is adult is reached. Option B is it is lifelong process. Option C is graduation. Option D is marriage. Which option is the correct answer? Important MCQ beta. Important MCQ. Socialization ends when? Socialization ends when adult is raised. Option B, it is a lifelong process. Option C, graduation occurs. Option D, marriage. Answer करो फटाफट. Which option is the correct answer? So socialization ends when? It is a lifelong process. And it is a lifelong process. Lifespan. So it is a lifelong process, right? Next question, question number 80 is which factor is most strongly associated with factor is most strongly associated with social cohesion is modern complex societies according to Durkheim? Option A is mechanical solidarity. Option B is organic solidarity, that is interdependence. Option C is isolation. Option D is lack of rules. But which option is the correct answer? Which option is the correct answer? Which option is the correct answer? Option B is the correct answer. Organic solidarity or interdependence is the correct answer. Next question, question number 81 is patrilineal descent means. Patrilineal descent means, right? Option A is tracing kinship through the mother sides. Option B is tracing kinship through the father sides. Option C is tracing kinship through both parents. Option D is no kinship tracing. So correct answer is option B, tracing kinship through the father's side, right? Patrilineal descent means tracing kinship through the father's side, right? Important MCQ. Next question, question 82 is what is social engineering? What is social engineering? Option A is planning society to influence social attitude and behaviors. Option B is building roads. Option C is designing computer programs. Option D is studying population statistics. So which option is the correct answer? But the correct answer is option A, planning society to influence social attitudes and behavior, that is social engineering. Next question, question number 83 is collective consciousness refers to. Option A is the shared beliefs, ideas and moral attitudes which operate as an unique force within society. Option B is individuals. Option C is a political campaign. Option D is the study of economy. So which option is the correct answer? Correct answer is option A. So collective consciousness refers to the shared beliefs, ideas and moral attitudes which operates as a unifying force within society. Option A is the correct answer, right? Next question number 4 is what is the cultural assimilation? What is the cultural assimilation? By a minority group adopt customs and attitude of dominant culture. Option B is keeping one's own culture separate, moving to a rural area. Option D is the decline of religion. Which one is the correct answer, beta? So correct answer beta option is the process by which cultural assimilations is the process by which a minority group adopts the customs and the attitude of the dominant culture, right? So option A is the correct answer beta. Right now. Question number 85 is which of the following is a primary social need met by the family? Option A support, option D emotional security and socialization, option C political power, option D educational certification. So which option is the correct answer beta? Economic support, emotional security and socialization, or political power, or educational certification? So correct answer is beta emotional security and socialization, right? Emotional security and socialization. ठीक है ना? Next question, question number 86. Gender stratification levels. Gender stratification levels. Option A is unequal distribution of wealth, power, and privilege between genders. Option D is the equal pay for men and women. Option D is the free population. Option D is the different jobs available in an economy. Gender stratifications. So option is the correct answer. The unequal distribution of wealth, power, and privilege between gender stratification. Right? Gender stratifications. Next question, question number 87. What is social construction of reality? What is social construction of reality? What is social construction of reality? Option A is the idea that socially is created through human interactions. Option B is that reality is fixed and objective. Option C is the study of building houses. Option D is the belief that technology defines reality. So which option is the correct answer, beta? Correct option is option A. The idea that social reality is created through human interactions, right? Option A is the next question. Which of the following is an AIIMS status? Option A is being all option B is being daughter of a king. Option C is being born in a specific country. Option D is being of a certain race. That is the correct option. Which option is the correct answer, beta? AIIMS status. Option A is the correct answer. Being an Olympic athlete. Achieving the status of an athlete requires talent, training, and effort. Right? Athletes को कौन required talent, training, and effort दरकार. That is achieving status of an athlete requires talent, training, and effort. Beta. Next question, question number 89 is social capital refers to. Option A is money in a bank account. Option B is networks of relationships among people who live and work in a particular society. Option C is building infrastructure. Option D is the number of people in a country. So which option is the correct answer, beta? Social capital refers to. Which option is the correct answer? Correct answer is option B. Social is a network of relationship among people who live and work in particular society. Option B is the correct answer. Next question, question number 93. What is deviance? What is deviance? Option D is always illegal behavior. Option B, behavior diverges from social or professional skill. Option D is following rules. So correct answer कौन होगा? Option B, behavior that diverges from the social norm. है ना नहीं? Next question, urbanization of leads, urbanization of more formal and personal social ties, stronger community ties, vision of technology. So which one is the correct answer, beta? So correct answer is aim option A, more formal and impersonal social ties. Question number 92. What is cultural relativism? What is cultural relativism? Option A, judging a culture by its own standard. Option judging all culture by one's own standard. Option C, disliking other cultures. Option D, moving to another country. Moving to another country. So which option is the correct answer, beta? Which option is the correct answer? The correct answer is beta option A. Cultural relativism is judging its own standard, right? Cultural relativism. Option A is the right answer. Next question, question number 93. The division of labor in modern society results in. The division of labor in modern society results in. Option A, greater interdependence. Option B, less specialization, more simple. Option D, no need for money. So which option is the answer? So which option is the correct answer? Division of labor in modern society results in. So correct answer greater interdependence. Option A is the correct answer, right? Next question, total institution was coined by. Option A Irving Goffman. Option B Karl Marx. Option C August Comte. Option D Max Weber. Already कही सर्च बेटा. This is which the total institution was a term coined by Irving Goffman, right? Irving Goffman coined the term that is total institutions, right? Total institutions. And he described institutions like persons that controls aspect of person's lives, right? Institutions like person that controls aspect of person's life, right? So कौन हबा total institution Irving Goffman. Right? Next question, question number 95. Which of the following is a social determinant of health? Option A genetic predispositions. Option B availability of clean water and sanitation. Option C physical exercise. Option D personal choice. So which one is the correct answer? Option B is the correct answer. Availability of clean water and sanitation. That is social determinant of health. So 96, what is social mobility? What is social mobility? Option A, movement between social strata. Option B, moving house. Option C, the speed of internet. Option D, political voting. So which one is the correct answer? Correct answer is option A, movement between social strata. Right, movement between social strata. Next question number 97. The concept of enemy is associated with the breakdown of option A, social norms and economic growth. Option C, physical health. Option D, family ties. Which one is the correct answer? Which one is the correct answer? Which one is the correct answer? Which one is the correct answer, beta? फटाफट आंसर कर दो. Which one is the correct answer? So correct answer is option A. Right, correct answer is option A. Next question, question number 98. Mores are. Option A folk ways with moral significance. Option B informal rules. Option C fashion trends. Option D legal documents. So correct answer is option A. Option A. Next question, question number 99. What is social stratifications? Option A the hierarchy of social groups. Option B the study of climate. Option C the building of houses. Option D the voting process. So correct answer is option A. the hierarchy of social groups. Next question, question number 100. That is sociology is considered a option A is hard science, option B is social science, option C is biological science, option D is language. So correct answer is social science, right? Option B is the correct answer. Beta sociology ro 100 questions आमे सरेले, right? Sociology रो 100 क्वेश्चन सरेले भी मेडिकल सर्जिकल नर्सिंग पढ़बो बहुत इंटरेस्टिंग सब्जेक्ट, राइट? इंटरेस्टिंग सब्जेक्ट आम नर्सिंग रो मोस्ट इंटरेस्टिंग सब्जेक्ट होची मेडिकल सर्जिकल नर्सिंग, राइट ना? नेक्स्ट क्वेश्चन एमएसएन रो फर्स्ट क्वेश्चन बेटा, एमएसएन रो फर्स्ट क्वेश्चंस डे 2 रो MSN रो first question. What is the primary nursing priority? What is the primary nursing priority for a patient experiencing an acute asthma attack? Option A रचे administering antibiotics, option B रचे assessing breath sounds and oxygen saturation, option C रचे educating the patient on triggers, option D रचे performing a chest X-ray. So which option is the correct answer beta? So correct answer is option B, assessing breath sound and oxygen saturations. Assessing breath sounds and oxygen saturations, right? This is the primary nursing priority for patient experiencing an acute asthma, right? I mean breath sound assess करने बाद and oxygen saturation को देखवाया assess करने बाद. Question number 2 which sign is characteristics of a patient with deep vein thrombosis? Which sign is characteristics of a patient with deep vein thrombosis? That is DVT. Option A breast skin sign, option B Homan signs, option C Chadwick. So Chadwick signs and option D is Cullen signs. Which option is the correct answer? तो करें साइज बेटा होमेन साइन, राइट? होमेन साइन डीटी रे हमें ओ साइन देखो पाउचे इवेंट होमेसिस रे होमेन साइन, राइट? इवेंट होमेसिस रे होमेन साइन देखो को मिलचे हमको. दिस इज ए क्लासिकल साइन ऑफ डीवीटी बेटा. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 3 अच्छी. A patient with type A diabetes is found unconscious. What is the first action? What is the first action? A patient with type 1 diabetes is found unconscious. What is the first action? Option A administer subcutaneous insulin, administer oral glucose, option C blood glucose level, option C call for help and prepare for IV dextrose. Diabetes type 1 diabetes found unconscious, hello. So हमारा first action कौन हबो? So first action is blood glucose level, right? Question 4, which electrolyte is mostly associated with the of diuretics? Hyperkalemia, option B is hypokalemia, option D is hypercalcemia, option D is hyponatremia. So correct answer कौन हबो? Option B hypokalemia हबो, right? Loop diuretics, furosemide और lasix, right? lasix यदि हमें देले कौन को electrolyte imbalance हबो? पोटेशियम imbalance हबो, कौन हबो? decrease बेटा hypokalemia हबो, right? Hypokalemia हबो. Next question, question number 5 अच्छी. The R in the room mnemonic. The R in the room mnemonic for acid imbalance stand for. Option A is respiratory opposite, option B is respiratory equal, option C is renal opposite, option D is renal equal. So which option is the correct answer? 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 So correct answer is beta option A, respiratory opposite, right? Respiratory opposite. The R in the Rome mnemonic for acid base imbalance stand for respiratory opposite. Option A is the correct answer. Next question, question number 6. What is the most appropriate diet for a patient with chronic kidney disease CKD? Option A is high protein, high potassium. Option B is low protein, low potassium, low sodium. Option C is high sodium, high protein. Option D is low calcium, high protein. So most appropriate diet कौन दिया हुए CKD patient रे? फटाफट आंसर करो फटाफट. Right, beta, very good. Option B is the correct answer. Right, option B is the correct answer. Low protein, low potassium, low sodium. Right. Next question. Question number 7. Which position is recommended for a patient after liver biopsy? Which positions? Most important MCQ. Before MCQ also most important, beta. Very, very important. Very, very important, beta. Next question. Which position is recommended for a patient after a liver biopsy? Option A is supine, option B is the right side lying, option D is confusion. So which option is the correct answer? So correct answer is beta option C, right side lying positions. So right side lying position कौन पे दिया जाए? Right side lying position कौन हो? Pressure the biopsy site, pressure to the pressure to the biopsy site. The pressure देने हमारा कौन हो बेटा? Helps to prevent hemorrhage, right? Hemorrhage. है ना? Right side lying position दिया जाए after liver biopsy. Next question right is the cardinal sign of information in all except option J, redness, option heat, option C, pale, option D, pain. So which one is the correct answer? Option C, all are the cardinal signs of inflammation. Cardinal signs of inflammation. Right? Are the cardinal signs of inflammation? Redness, right? Redness, and can be. How कौन अच्छी 5 cardinal signs अच्छी 5 cardinal signs 5 cardinal signs. First is redness, right? Then heat गला, then pain, then how कौन अच्छी swelling. एक 2 3 4 number है swelling, right? Swelling. Last one is what? Last one is loss of functions. Pain and loss of functions, and last one is failure of illness. So loss of functions, right? हमको जाने वाला था कौन 5 cardinal signs, right? Redness, heat, pain, swelling, and loss of function. These are 5 cardinal signs of inflammation, right? Next question, question number 9 is which cardiac enzyme is the most specific indicator of myocardial infarction? And then option LDH. Which one is the correct answer? Which one is the correct answer? So myocardial infarction most specific indicators cardiac enzyme troponin I and troponin T. Troponin I and troponin T. These two are the cardiac enzyme or cardiac markers to diagnose heart muscle damage or myocardial infarctions. The option B is the correct answer. Question number 8. Patient with hyperthyroidism is at risk for which complications? Option A mixed edema coma. Option B is thyroidostorm. Option C is option D is bradycardia. So बेटा which is the correct answer? फटाफट आंसर करो बेटा. मैं बहुत गुड़े क्वेश्चंस कवर अप कर रहा आज का डे 2 राइट ना. So correct answer B, thyroidostorm. How about thyroidostorm? A patient hyperthyroidism is at risk for complication. Thyroidostorm. Thyroidostorm is thyrotoxic crisis. Better thyrotoxic crisis, right? So option B is the correct answer. And thyrotoxic crisis is a life-threatening conditions है पर बेटा due to hyperthyroid symptoms. Question 11 what is the standard measurement for the mental test for tuberculosis? The color of the skin. Option B is the length, redness, indication or hardness, millimeters. Option D is the patient's temperature. So correct answer is option C, the indication or hardness in millimeters. So indication is measured up to 48 to 72 hours after injection to determine exposure to TB, right? So option C is the correct answer. Next question number 1 is primary cause of peptic ulcer disease. Helicobacter pylori infection. Option C is spicy food. Option D is over exercising. So which option is the correct answer, beta? So correct answer is option B, Helicobacter pylori infection. A is the primary cause of peptic ulcer. Important MCQ. This is also already assessed सारे वो एक नंबर assessed सारे चीज़ है ना. Questions को रख कर peptic ulcer सिर्फ which is the primary cause of peptic ulcer is Helicobacter or H. pylori लिखा है H. pylori infection और Helicobacter pylori infection. Next question number 13 है in Parkinson's disease primary deficiency is in option A coli, option B dopamine, option C serotonin, option D adenine. So which option is the correct answer? B is the correct answer. Dopamine हवा, right? Dopamine हवा. dopamine deficiency कौन हो Parkinson's disease, right? Is it caused Parkinson's disease? Right. Next question, which is finding expected patient with left side heart failure, option abdominal distension, option which crackles in the lungs or pulmonary edema, option cerebral edema, option D is ascites. So which option is the correct answer? Correct option hochi crackles in the lungs. That is the findings is expected in patient with left side heart failure. Left side heart failure. Next question, question number 15. The Glasgow Common Scale disease measures option respiratory rate, temperance. Already asked this search. The Glasgow Common Scale disease measures option respiratory rate, option level of consciousness, option series intensity, nutritional status. Which option is the correct answer? फटाफट आंसर करो चैट बॉक्स रे बेटा, फटाफट. आई वांट टू नो, मेरे को जानना है. फटाफट आंसर करो. ग्लासगो कोमा स्केल डिसीज मेजर्स ऑप्शन रेस्पिरेटरी रेट, ऑप्शन लेवल कंसिस्टेंस, ऑप्शन पेन इंटेंसिटी, न्यूट्रिशनल स्टेटस. सो करेक्ट आंसर इज जो मैं ऑप्शन ई करी तो माने बहुत भलो एंड आंसर पूछा. राइट, ऑप्शन बी इज द करेक्ट आंसर. लेवल ऑफ कॉन्शियसनेस कौन कौन हम देखिए. आई ओपनिंग, राइट, आई ओपनिंग, ई then verbal response, right? V, then motor response, EVM, right? इस मामले में कुछ की लेवल ऑफ इम्पेयरमेंट हिच हैला हम स्कोरिंग करू छी. टोटल स्कोर ऑफ जीसीएस केते मिनिमम केते 3 ला 0 ऑप्शन ले 0 है. सो मिनिमम इज 3, maximum is 15, right? Next question 16. Which of the following is a classic sign of appendicitis? Option A is point tenderness, option B is signs, option C is Blumberg signs, generalized, option D Tarso signs, option D Tarso signs. So correct answer is option which one is the correct answer? Appendicitis raw sign effect one is point tenderness, option A is the correct answer, right? Next question number 17. Patient with cirrhosis will be monitored for which neurological complication? Option A Alzheimer's disease, option B Parkinsonism, option D multiple sclerosis. फटाफट आंसर करो बेटा, फटाफट. हेपाटिक एन्सेफालोपैथी, मॉनिटर फॉर न्यूरोलॉजिकल कॉम्प्लिकेशन, दैट इज हेपाटिक एन्सेफालोपैथी हैला ताको हमको मॉनिटर करबार अछि माने नहीं फॉर व्हिच न्यूरोलॉजिकल कॉम्प्लिकेशंस. अदरवाइज यदि न्यूरोलॉजिकल कॉम्प्लिकेशंस को पड़ला ताले और पेशेंट डिटेक्ट करो. क्वेश्चन नंबर 18 अछि मेन पर्पस ऑफ इज स्पाइन, ऑप्शन टू मेन पेशेंट टू एटलासिस एंड न्यूमोनिया पोस्ट सर्जरी, ऑप्शन टू डेली मेडिकेशंस, ऑप्शन डी टू इंक्रीज ऑक्सीजन. व्हिच वन इज द करेक्ट आंसर बेटा? व्हिच वन इज द करेक्ट आंसर? करेक्ट आंसर ऑप्शन बी टू प्रिवेंट एटलासिस एंड न्यूमोनिया पोस्ट सर्जरी. व्हाट इज द मेन पर्पस ऑफ spirometry? It is to prevent epilepsy and pneumonia surgery. Next question number 19. Which sign indicates severe hypocalcemia? Which sign indicates severe hypocalcemia? Option A is toxic sign, option C is sign, option D chronic signs. So which one is the correct answer of C? Sign indicates severe hypocalcemia. So option B is the correct answer. Toxic signs or purple spasm indicates severe hypocalcemia due to low calcium, right? Due to low calcium level in the body, right? Due to low calcium neuromuscular irritability, right? Toxic signs and Chadwick signs are standard assessment of neuromuscular irritability, right? Toxic signs and Chadwick signs. How come? Toxic signs and Chadwick signs. CHBUSTEK is sign. Two signs are toxic and Chadwick signs. H indicates for severe hypocalcemia, right? Next question number 22. What is the normal range for serum potassium? Option 5 to 2.5 milligram, 5 to 5 milligram per liter, 7.35 to 7.4 milligram per liter, 135 to 145 milli equivalent per liter. So correct answer option B 3.5 to 5 milligram per liter. Next question 1. Which type of isolation is required for patient with option A contact percussion, option B droplet percussion, option C carbon percussion, option D standard percussion. So correct answer option C carbon percussion, right? Carbon percussion required for patient with this, right? Next question number 22. Achieve colostomy is surgical opening into the option A stomach, option B small intestine, option C colon or large intestine, option D bladder. So correct answer is option C, right? Colostomy creates an opening to the abdominal wall into colon, opening through abdominal wall into the colon, opening through the abdominal wall, opening through the abdominal wall into the colon. That is colostomy. Or typically elevated in the early stage of shock. Option H heart, option D blood pressure, option C respiratory rate, option D temperature. So beta which option is the right answer? Vital sign typically elevated in the early stage of shock. Early stage of shock कौन हुए? Heart rate, blood pressure, respiratory rate, and temperature. कौन होगा? correct answer वो heart कौन हुए? increased हुए, increased हुए, tachycardia हुए, water in this data. Next question 24. What is the characteristics of the what option B various stage of option B option D purpura. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is option B. Characteristics of chin box is maculofocal various stage of hearings. Different stages of lesions. The macules, papules, right? Vesicles, and crust. Crust. All of the different stages of lesions and characteristics of chicken pox. Next, which is most important for a patient with option is the pupil size and balance of the skin color. Which one is the correct answer, beta? So answer is option pupil size and reactivity. Pupil size and reactivity is most important for a patient with head injury. React to light or not reacting or not reacting to light. This assessment is most important for healthy patient reaction to light. So question is which of the following is a best classic clinical manifestation of hypothyroidism? Which of the following is a classic clinical manifestation of hypothyroidism? Good answer, what? So correct answer is option B. Weight gain, cold intolerance. Weight gain, cold. Correct answer is weight gain and cold intolerance, right? Next question, question number 27. In a patient with iron deficiency anemia, the nurse should encourage the intake of option A dietary products, option B foods high in vitamin C, option C low fiber foods, option D carbonated beverage. So correct answer is option B, foods high in vitamin C. Patient with iron deficiency, nurse should encourage the intake of food high in vitamin C. Option B is the correct answer. Next question, question 28 is what is priority nursing intervention for a patient experiencing a grand massive option is resistant patient which is a padded tongue blade in mouth, option is protect the head and maintain airway, option is administer IV medications. So which option is the correct answer? Which option is the correct answer? So correct answer is option C, protect the head and maintain airway. Option C is the correct answer. Priority nursing intervention for patients experiencing grand massive option protect the head and maintain airway. So option C is the correct answer. Next question, which condition is of deficiency in vitamin 12? Option is option C, plastic and option D thalassemia. So which option is the correct answer? Pernicious anemia. Pernicious anemia. Question 3. A patient with chest tube should have which of the following assessment reported immediately? Option A, gentle bobbing in the water seal chamber. Option B, tidling in the water seal chamber. Option C, continuous bobbing in the water seal chamber. Option D, sanguineous damage in the collection chamber. So which option is the correct answer, beta? Question number 3, the correct option है वो option C. Question 30, the correct answer continuous bobbing in the water seal chamber. Patient with tube should have in the water seal chamber. Jadi bobbing in the water chamber, then we report immediately the doctors. Next question, question 31. Which of the complication of bed rest? Option A, hypertension. Option B, pressure ulcers. Option B, hyperthyroidism. Option D, hyperglycemia. So answer option B, pressure ulcer. Pressure ulcer is a common complication of bed rest, right? Next question, question 32. Normal range for adult patient general anesthesia is 120/80. It has some normal blood pressure in adult, right? Question number 33. Which patient is at the highest risk for developing skin cancer? A person with dark skin who passes on B, person with fair skin who spends significant time in the sun. Option A, person who eats a high peptide. Option D, a person who lives in a cold climate. So which option is the correct answer? Answer is option B. Next question number 35. What is the nursing goal for a patient with acute pancreatitis? Option A, management and bowel. Option B, changing high protein meals. Consider changing physical activity, adds iron supplement. So which option is the correct answer? Which option is the correct answer? Primary nursing goal for a patient with acute pancreatitis. So हमको कौन करवा चाहिए? So patient pain करवा चाहिए and bowel rest दवा चाहिए, right? Rest नहीं होगा patient को impure रखवा को पड़ेगा, हाँ नहीं ताले bowel rest नहीं पड़ेगा, हाँ नहीं and effect analysis दवा कौन है? To reduce pain, to reduce pain. Next question, question number 35. A patient with colostomy should be educated to avoid option A, drinking water. Option B, food sectors, excessive gas, clothing. Option D, daily hygiene. So which option is the correct answer? Question number 35. A patient with colostomy should be educated to avoid foods that cause excessive gas forming foods ଆମେ କଣ କରିବା avoid କରିବା right gas forming food can cause failure of the colon and patient discomfort same ଆମେ gas forming foods दबाने like beans cabbage right next question number 36 which diagnostic test used to visualize the gallbladder option A रची colonoscopy option B रची cholecystography और ultrasound option C रची gastroscopy option D रची cystoscopy which one is the correct answer option B cholecystography or ultrasound right ultrasound is the most common diagnostic test for identifying gallstone and gallbladder inflammation gallstone and gallbladder inflammation by ultrasound करा जाओ ना कि gallstones and gallbladder inflammation जानबा पाए inflammation जानबा पाए हम कौन बोलू छे ultrasound करू right next question what is the purpose of the METOX test what is the purpose of the METOX test option A to diagnose option B to screen for tuberculosis exposure option C to take for HIV option D to determine the type so ये questions आसी सारे चला important MCQ तो करेक्ट आंसर कौन होगा स्क्रीन फॉर ट्यूबरकुलोसिस एक्सपोजर नेक्स्ट क्वेश्चन नंबर 88 अछि एटासिस ऑप्शन ए रजी फंक्शन प्रोग्राम ऑप्शन बी कोलाप्स ऑफ द लंग्स एल्वेओलाई ऑप्शन सी रजी एक्सेसिव फीडिंग द चेस्ट कैविटी ऑप्शन डी बैक्टीरियल इन्फेक्शन ऑफ द लंग्स व्हिच ऑप्शन इज द करेक्ट आंसर आंसर इज ऑप्शन बी कोलाप्स ऑफ एल्वेओलाई एटासिस इज आल्सो कोलाप्स ऑफ एल्वेओलाई ऑप्शन बी द करेक्ट आंसर नेक्स्ट क्वेश्न नंबर 39 which patient position based for a patient respiratory distress which patient position based for a patient respiratory distress तो करेक्ट आंसर कौन होगा ऑप्शन ए रजी सुपाइन ऑप्शन बी हाई फाउलर ऑप्शन सी रजी ऑप्शन डी रजी लेटर so correct answer is high fowler positions patient respiratory distress होची ताले हमें high fowler positions दवा for maximum lungs expansion maximum lung expansion right or expansion and improve oxygenation right next question 40 is a drop in blood sugar and is heart rate may indicate option is hypervolemia option B is hypovolemic shock option C is bradycardia option D is hypertension so two option have correct answer which option is correct answer beta a sudden drop in blood pressure increase heart rate may indicate so correct answer is hypovolemic shock. So classic sign of fluid volume deficit of circulatory collapse. Silicon hub sudden drop in pressure and increased heart rate and that is due to hypovolemic shock. Hypovolemic shock देखो कौन होची sudden drop in blood pressure and increased heart rate. ताकि कार्डिया हब है ना. Right now next question number 41 is which vitamin is required for blood clotting option is vitamin option D option D vitamin E. So correct answer option C vitamin K synthesizes several clotting factors नहीं so proper blood clotting vitamin K option C is the correct answer next question 42 the 3 P's of diabetes mellitus important very important 3 P's of diabetes mellitus option A polyphenol option depend paralysis option C pressure pulse pain or protein potassium phosphorus so correct answer is option A polyphenol classical symptoms of diabetes mellitus classical symptoms of DM polydipsia polyphagia next question 4 is what the medical term for difficulty swallowing what the medical term for dyspepsia option dyspepsia option dyspnea which option is the correct answer difficulty in swallowing it is dysphagia refers to impairment the swallowing process impairment of the swallowing process or difficulty in swallowing process that is dysphagia next question 55 which nursing crucial when administering potassium A question intermittent next question which nursing action is crucial when administering IV potassium administer diabetic bolus option insert is diluted and check site patency option C is administer it subcutaneously option D is it without any fluid which one is the correct answer option B is the correct answer insert is dilute and check site patency option B is the correct answer without dilution दवा ताले कार्डियक कार्य नहीं होगा और जल्दी फटाफट टू क्विक दवा बोलस ले पुश करनाएंगे ताले कार्डियक अरिथमिया की पेशेंट दीजिए राइट सो डाइल्यूट कर दवा है ना नहीं पोटेशियम किसी लंट्री लोगों छे ना है ना नहीं next question for patient with cirrhosis of the liver is only restricted by why option B plus option D ammonia level option D to lower blood pressure so which option is the correct answer beta which option is the correct answer so correct answer is option B right option B to decrease ammonia levels patient with cirrhosis of the liver is restricted by why ammonia levels next question number 46 रचे which of these is only option is cyanosis option B is restlessness and anxiety option B रचे option C रचे coma option D रचे hypertension Which of the following is an early sign of hypoxia? Cyanosis, restlessness and anxiety. Option C is coma. Option D is hypotension. So which option is the correct answer? Correct answer is option B, restlessness and anxiety. Goal of physical therapy to diabetes is option A is to cure disease, option B is to maintain glucose within a target, option C is to decrease weight loss, option D is to improve appetite. So which option is the correct answer, beta? Which option is the correct answer? So फटाफट आंसर बेटा. Which option is the correct answer? Which option is the correct answer? Which option is the correct answer? Question number 47. So correct answer is option B. Within those levels within the target range, right? So insulin therapy can prevent complication of hyperglycemia while avoiding hypoglycemia, right? हाइपोग्लाइसेमिया हबो नै सो सेही पे हमको मेंटेन कर ग्लूकोज लेवल को विदिन ए टारगेट रेंज रखा कॉमन की अधिक हबो नै राइट कॉम्प्लिकेशन ऑफ hypoglycemia while avoiding hypoglycemia right हमें टारगेटेड रेंज रखा पहले maybe increase right next question 48 which site is preferred for an IM injection in infants so correct is option is vastus lateral option is possibility option is ventrogluteal ventrogluteal option B lateral is both developed muscles in infants and imaging nerve injury risk right imaging nerve injury risk so hamsters lateralis infant man ko IM right option B is the correct answer question number 49 patients affected meningitis should be placed on option A is AR1 precursors option B is droplet precursors option C is contact precursors option D is reverse isolations so which one is the correct answer so correct answer is option D droplet precursors so bacterial meningitis is spread by respiratory droplet or requiring this person until 24 hours of 24 hours of antibiotics are completed because only 24 hours of antibiotic are completed respiratory droplets तो हमको spread by respiratory droplets से हमको droplet precursors right next question number 50 type it find option A 60 option is better than 100 option C rhythm option D option pulse which option is the correct answer which option is the correct answer which option is the correct answer so the answer is option B pulse greater than 100 beats per minute helium tachycardia option B is the correct next question number 51 is the best indicator of long-term blood glucose control option A is fasting blood glucose option B is B post prandial glucose option is serum creatinine so which one is the correct answer so correct answer is beta option B HbA1c so HbA1c reflects the average blood glucose levels over the past to 3 months right 3 months blood glucose level कोने जानी पाउछ average blood glucose level जानी पाउछ with the help of HbA1c diagnostic test right next question 52 patient with head display a clear leaking of the nose what is the priority in sentence option C impact the nose with gauge option D test the fill for glucose ask the patient to blow their nose option D administer antihistamines so which option is the correct answer beta which option is the correct answer answer option B test the fluid for patient with head display cleft leaking from the nose what is the priority nursing action test the fluid for glucose नहीं सी फ्लूइड को हम कौन करवा टेस्ट करवा फॉर ग्लूकोज नेक्स्ट क्वेश्चन नंबर 53 which clinical manifestation hesitation is characteristics of chronic obstructive pulmonary COPD barrel chest option B is weight gain option C low blood pressure option D is high fever so which one is the correct option beta which option is the correct answer so correct answer is barrel chest clinical manifestation characteristics of COPD right barrel chest is the manifestation of clinical manifestation of COPD right next question for antidote for warfarin or antidote for warfarin overdose vitamin heparin and which one is the correct answer 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 beta the antidote for overdose antidotes obviously give it option is the correct answer all discuss option is the correct answer question number 55 which case spending percentage to the doctor option is dry parasitic blanchable erythema stage 1 pressure injury option C is minor wishing option is normal bose so which one is the correct answer beta option B is the correct answer non blanchable erythema or stage 1 pressure injury skin spend finding per immediate report doctor right this assessment require immediate referring to the doctor's beta next question number 56 what is the primary cause of pulmonary embolism what is the primary cause of pulmonary embolism MCQ what is the primary cause of pulmonary embolism a chronic cough option B is the third option Option is distal blood clot or usually fluid traveling to the lungs. Option is severe pneumonia. Option is allergy. So which one is the correct answer? Which one is the correct answer? Beta? So correct answer is option B, right? Dislodged blood clot or usually from BT or traveling to the lungs, right? Option B is the correct answer. Question number 57. Patient with nephrotic syndrome typically presents with option is edema and protein UV. Option is high blood pressure and dehydration. Option is high weight loss and fatigue. Option is polyuria. So option is the correct answer. Correct answer option D, beta. Patient with nephrotic syndrome typically presents with edema and protein UV, right? Increased glomerular permeability leads to high protein loss in the urine. Right? Increased glomerular permeability leads to high protein loss in the urine, right? High protein loss in the urine causing severe edema, right? So severe edema and proteinuria high in the swallow patient with nephrotic syndrome, right? Next question to read: which medication is used to treat better in an emergency? Option which option is the correct answer? Which option is the correct answer? Which medication is used to treat bacteria in an emergency? Option is propanol. Option is nitrosamine. So correct answer, beta. Option A, that is atropine, right? Next question, question number 59. The A in the ABCD rule for assessing skin region stand for. Option A appearance. Option B asymmetry. Option C area. Option D line. So correct answer is beta. Option D asymmetry, right? The ABCD rule for assessing skin region A stand for asymmetry. ABCD rule. A stand for asymmetry, right? B stand for border. B stand for border. C stand for color, and D stand for diameter, right? This is the ABCD rule for assessing skin region. A stand for asymmetry. Option B is the correct answer, beta. Next question, question number 60. Which position is most beneficial for patient with congestive heart failure and dyspnea? Option A flat spine. Option B channel walk position. Or sitting up and leaning forward positions. Correct answer is which position, beta? So correct answer is option C, orthopenic or sitting up and leaning forward positions. It's most beneficial for a patient with congestive heart failure and dyspnea, right? Next question 61. What is the family goal of gastric lavage? Option A to diagnose an ulcer. Option B to empty the stomach contents, or for example infogeny or overdose, right? And option C to administer medication. Option D to feed the patient. So correct answer is which one is the correct answer? Correct answer is option B, right? Gastric lavage. Remove toxic substance from the stomach. Question 62. Finding found in patient with rheumatoid arthritis. Option A morning sickness lasting over an hour. That improves with 80% involvement of one joint obesity. Which one is the correct answer? Which one is the correct answer, beta? Which one is the correct answer? Which findings on inhibition of arthritis? Option A morning sickness lasting over an hour. Option B that improves with 80% involvement of one joint. Option B obesity. So correct answer is A morning stiffness lasting over an hour. Another common in patient with rheumatoid arthritis, right? Next question, question number 63. What should assess people administering the oxygen? Option A respiratory rate. Option B apical pulse for 60 seconds. Option C blood glucose. Option D skin integrity. So correct answer is option B, apical pulse for 60 seconds. Apical pulse for 60 seconds. What should the people go in apical pulse for 60 seconds? Right? Question 64. Which of the following equation of IV infiltration? Option A inflammation and swelling at the insertion site. Option B hypertension. Option C bradycardia. Option D high fever. So correct answer option A, inflammation and swelling at the insertion site. Of the following complication of infiltration. So MCQ, beta, important MCQ. Inflammation swelling at the insertion site. Next question 65. Patient with hypernatremia, high sodium DSSSB. Option A thirst and the mucous membrane. Option B muscle sound. Option C low blood pressure. Which is the correct answer is option A, thirst and dry mucous membranes. Patient with hypernatremia, high sodium DSSSB, thirst and dry mucous membranes. Next question 66. What is the standard treatment for hypertension pneumothorax? What is the standard treatment for antibiotics? Option B condition of Jesus. Option C oxygen only. Option D wireless. So which one is the correct answer?